thanks for watching Vixer and welcome back. In this video I'm going to answer some questions about pre-op feature about the video that I've posted before. You can also find it in our channel. I've received some directs in Instagram and also some comments in our YouTube channel that there are some problems while adapting the crowns to the pre-op scan and how we can exclude some parts to be adapted to the pre-op scan. So I'm gonna work on it in this case and make it a little bit more clear to those who have problem with that. I'm gonna start with a demo case that is already available in DentalDB. As I said before, you can also check the mesh that scans in the 2D preview in DentalDB. So I have the digital impression scans and the pre-op scan. Let's start with the design, and I'm gonna make myself a little bit smaller to make more space. Yeah, that looks good. Okay, first step is the correcting pre-op scan placement. If needed, you can move it in different directions and yeah, do some corrections, but in this case looks good. We go further. 3D data editor, I've explained it before, not needed for this case. Next, margin line detection, one click should be enough. Yes. Next, crown bottoms, not needed. Next. Yes, we have now copy mirror tools. In this case I'm gonna use the tools from the library and what is available. You can change the tools library here from generic to, for example, alternative in this case, and do the placement using hotkeys Control and Shift to rotate and to scale the tools. As you see, the pre-op scan is also available. I'm going to use it later. So I suppose that this tools placement is good. Go further. Here, before I do any freeforming, I'm going to go to the expert mode and then right click and do some adaptation to the pre-op scan. As you see, my pre-op scan is available. So right click in the expert mode and adapt to pre-op scan. You have a fast option by adapting the model teeth to the pre-op scan, and it will be shaped as exactly my pre-op scan is. Fast and easy. There is also another option. I'm gonna click undo to exclude some selected parts. So in this case, I'm gonna exclude some parts from adaptation to the pre-op scan. You can do it in some cases for the labial or some proximal parts if needed. So I mark this area, and this area won't be adapted to the pre-op scan. Let's see how it works. Yes. Click OK, and I'll go back to the wizard, and without the pre-op scan you can see exactly what happens here. Now it's time to do some freeforming, and yeah, check the height of the crown and the rest. So that's it for now. Thanks for watching and stay tuned.